Hi, friends. Happy Wednesday evening. My brain is totally not functioning. I feel like every time I see you guys, it's on like a Friday evening. So happy Wednesday. I hope you all are having a fantastic start to your week. The chat today is on for members only, but this is viewable to everybody. And if you want to chat, if you want to talk, give your input, your 2 cents, and ask your questions, please feel free to join our YouTube membership. We have plans starting as little as, I think, $1.99 a month. So that is how you will be able to chat. But I'm so excited to talk to you today about new grad preparedness, things that I think are important considerations for being a new grad, working with your preceptor, and being successful in that first year of clinical practice, because I know that this can be really tough. Before we start, I want to say thank you so much to Elizabeth for joining membership. We are so happy to have you. It is not too late for you to join membership. You can join right now and the chat will be open to you. But thank you so much, Elizabeth. So by all means, if you have questions, feel free to just drop them in the chat at any moment in time, and I will address them as I can. But I wanted to just kind of talk to you loosely about my ideas for new grad preparedness. And before we begin, I want to say that being a new grad is very different than being a nursing student. And that might seem like common sense. However, you would be surprised by how many people expect that their new grad year is going to be just like it was in nursing school, just like going to clinical in nursing school, or even, if you got the opportunity to do like a preceptorship in nursing school. However, when you transition to clinical practice, you're now no longer training to be a generalist nurse, at least here in the United States. You are now training to be a specific type of nurse on your specific unit within your specific facility. And I say facility because you don't have to be a new grad in the hospital. And I want to make that very clear. There is no requirement for you to ever work in a hospital. There's no requirement for you to ever start out on med-surg. If you want to, by all means, please do. That's fantastic. But when you are in that new grad period, you really are learning how to be the type of nurse that is needed for the environment in which you work. And that can be a really difficult transition. I don't know about you guys, but one of the things that I think about all the time when it comes to my experience in nursing school is tuberculosis or brachytherapy. These are two very specific types of things that are covered in nursing school that you are expected to know everything about. You have to know the medications to treat tuberculosis, signs and symptoms of tuberculosis, isolation precautions for that, patient teaching, all of those sorts of things. And do you know how many times I have seen tuberculosis as an ER nurse? Never. I've never once seen it. And I'm not saying that TB doesn't exist in the United States, but I'm saying that I was required to learn so much more about TB than I ever have to use in clinical practice. But you know what they didn't teach me in nursing school? They didn't teach me the order of draw of your blood. What order do I collect blood in? They didn't teach me what is in a CBC, what is a BMP versus a CMP. Why do we draw a lactate and why does it have to be on ice? They didn't teach me how to get a 12-lead EKG. Those are things that I use every single day as an ER nurse. However, those are not necessarily things that another nurse in another facility might need to know. So it can be a little bit of a shock when you get into your new grad experience and you are suddenly thinking, am I dumb? Do I not know anything? And the answer is no, you're not dumb. You are not stupid. You are still learning, first of all. And I want you to learn that phrase and commit that to memory and say it to anybody who ever makes you feel stupid for not knowing something when you are still learning. And the second thing is, no, you don't know. You don't know how to be an XYZ kind of nurse because that's not what nursing school prepared you to do. Nursing school prepared you to be able to think critically enough to pass the NCLEX, which is very important. However, it is your job that is going to train you to be the kind of nurse that you need to be for that facility, for that unit, for that specialty. So first and foremost, we are not panicking when we get into our new grad experience and we think this is nothing like nursing school was. We are not panicking when we spend a couple of weeks on the unit and think I don't know anything. I don't know how to do any of this. We are not panicking about the fact that we've never done XYZ skill. That's okay. You are only doing skills in nursing school to demonstrate that you are capable of following instructions without harming your patient. So it is your job that is going to teach you the skills that you need to be successful. I genuinely believe that nursing students get really worked up about skills in a way that is understandable, but unnecessary because you will learn your skills on the job. The skills I need as an ER nurse are vastly different than the skills that my orthopedic med-surg floor nurse friend needs to know. They're vastly different from the skills that my NICU nurse friend needs to know. So there's no way that we can teach you all the skills that you need to know for your job in nursing school because that's not the point. You'll get that on the job. So we're not panicking about any of that. Now, preceptor stuff. I love precepting. I love getting to work with people who are new to our unit or new to nursing in general. I think it is the coolest and most special experience. I love every second of it. But not everyone does. And I want you to know that in the past, people who were precepting were people who volunteered to precept, who have extensive years of experience in that floor, in that setting, as a nurse, whatever it may be, and very likely have taken some kind of a class through their facility to prepare them on how to be a preceptor. But that may not be the case for you right now. We see a lot of change happening in the bedside environment. We see a lot of people leaving to go travel, so they may not be established in that unit or that hospital the way they would have if they stayed staff. So you may end up with somebody who didn't necessarily want to be a preceptor, who maybe doesn't love it a whole bunch. And that's unfortunate. And I hope that that is not the case for you. But you still have every opportunity to make it a good experience. And also, I want to empower you to speak up if you feel that things are not meeting your educational needs, if you feel unsafe in any way, if you feel bullied or harassed in any way. It is important for you to be an advocate for yourself in that manner. So let's talk about that a little bit. When it comes to you as a new grad working with a preceptor, open communication and honesty is 100% key. And the way that I suggest starting out a relationship with your preceptor is to tell them about yourself. Tell them about your experience. Hey, my name is Meris. I'm a new grad. This is my first day ever being a nurse. That is a really important thing to say because they might forget that. And that sounds silly, but it's really easy to be like, all right, come on, let's just, you can give that med, right? Not remembering like, oh, you've never actually given meds without a nursing school clinical instructor standing over your shoulder. So that is super important, is to be able to have that open communication and say, listen, this is my first day ever as a nurse. Here's what my background is in. So for instance, I said, I used to work pre-hospital EMS. I worked in outpatient OB-GYN for over a decade. I was a phlebotomist and an IV specialist. So those are my strong suits, right? Tell them what you're good at. Tell them the things you feel confident about. But I have no experience doing XYZ. I am interested in learning more about this other thing. I would like to improve my skills in whatever arena. That is a really good way to kind of set expectations with your preceptor. Let them know who you are, what you're about, what your history is, and where you already know that you need help. The other thing is, I would really encourage you to debrief at the end of a shift, just briefly, with your preceptor. And it doesn't even necessarily have to be every shift, but maybe once a week. And just say, these are the things that I see you doing well. These are the ways that I think that you can improve. And be willing to take that as constructive feedback and not personal criticism and an attack. We want to improve. So if there's a way that our preceptor can see, hey, you're so good at this, your therapeutic communication is amazing. You really, you knock it out of the park whenever you talk to the families. However, we're forgetting to ask for name and date of birth, right? Like that sort of stuff, like that's important. And that helps you know how to improve and where you can improve. So I'm going to briefly address this question from Sarah. How do you properly address concerning behaviors from another student in clinicals? This is a great question. She follows it up by saying, do you say something or do you keep things to yourself. So first and foremost, I think it depends on what is the concerning behavior. Is it something that is a safety issue? Is it something that you believe could lead to an unsafe outcome for your patient? Is it something that is unsafe for you? You know, are you being bullied, harassed, made to feel unsafe in your clinical environment, whatever it might be? In which case, I would say definitely I would bring it up. I would strong, especially if it has to do with patient safety, I would say you just have to. You just got to bring it up. But is it something that's like personality conflict, that you don't like the way that they, you know, I don't know, like I can't even like think of a good example off the top of my head. But if it's something that is not like a truly kind of desperate, like somebody needs to intervene or something bad is going to happen, then I think it's kind of up to your discretion about whether or not you want to say something. The way I would do it though is I would always first address the issue with your student directly with the other student, and if you can, if you feel comfortable, if you feel safe, having that, saying, hey, listen, you know, it really made me uncomfortable the way that you talked about that patient. You know, I was hoping we could talk about that. It just felt like you were diminishing their concerns, or you know, whatever it might be. And if that doesn't go well, then I would move up to talking privately with your clinical instructor or with your professor about the behavior, and going from there. It's always best to come prepared with information about where it happened, when it happened, who else witnessed it, any direct quotes, you know, whatever you can write down, even if you're just jotting it down in a note in your phone. Being able to support your claim is very important. So this person is always on his phone, neglecting his patients. He talks about how unorganized the program is to patients, and he said in front of patients multiple times that a patient should be restrained. Personally, I think that is a big deal. If we are saying that a patient should be restrained in a manner that is threatening, that is legally assault. And so that's not great. And then second of all, patients should never be restrained unless there is an actual legitimate indication for it, such as risk of harm to self or others. So something like that, you know, I feel like I would bring that up. But as with everything, I would say it's always up to your discretion. It is up to whether or not you feel safe bringing it up, if you feel comfortable bringing it up. You know, it ultimately it is in the best interest of that person's future patients, that that behavior be corrected right now as soon as possible. But it is also, you know, I can understand where it may be unsafe or uncomfortable for you to have that conversation with him or with your clinical instructor. But your mileage may vary. I would just consider uh, the context for you yourself personally. I hope that makes sense. But going back to new grad stuff, preceptorships, I think, are really important. And every hospital does it a little bit differently. You may have, oh, hi, G. Thanks for joining membership. We're so happy to have you. You may have a hospital situation where, like, my orientation was 16 weeks long, and that was standard for those of us who work in the emergency room. There's a lot to learn. You are caring for truly high acuity patients. We are a trauma center. There is so much to pay attention to. So we got 16 weeks where on the floor in med-surg, they might have gotten somewhere between 6 and 8. That kind of a thing is important to look into when you are talking in your interviews. So if you're interviewing for your new grad position, I would very much say, can you tell me about your orientation? Can you tell me how long it lasts? How do you decide? This is the best stuff to ask when they say, what questions do you have for us? You always want to have questions for them. So what does your orientation look like? How long is it? Am I with the same preceptor? Hey, if I'm going to be on night shifts, do I precept on days or do I start off on nights? All of those are super important. Will I have the same preceptor the whole time, or will I be rotating through? How do you decide who to partner with whom? When I was getting ready to start my new grad job, I got a phone call from the unit manager, and I'm sorry, not the unit manager, the unit educator, and she asked me about what kind of a learner I am, kind of what my personality type was, what kind of a preceptor I thought I would do well with. And then as we were talking, she said, I have the perfect person for you. And she was 100% right. My preceptor was incredible. She made me the nurse that I am today, and I think about her every single shift because she made such a positive impact in my life. However, that may not be the case for everybody, and you may end up with somebody who you think is less than ideal, at least for you and how you learn. Again, if you have an issue with your preceptor, it is always best to start by having a conversation with your preceptor, one-on-one in a private environment when there are not 10 million things going on at once, and to say, hey, whatever the issue is. It really made me feel, it made me feel embarrassed when you called me out in front of the patient for not knowing how to do XYZ. Or, hey, I think sometimes we get a little bit rushed and you might not remember that I've never done this before. I'm really struggling with this. I would love it if we could take some time to work on that next shift. If you jump straight ahead to going to the unit educator or your unit manager or whoever it may be, the first thing they're going to ask you is, what did you do to address the situation before coming to me? You are expected to go up that chain of command, and always better to start by addressing that issue head on with whoever that person might be. So whether that's somebody on the unit who you feel is, making you feel stupid or isn't willing to help you, start with them, right? Before we ever go somewhere else. So if something isn't right with your preceptor, assume innocence, unless they are being like just outright bullies to you. Assume innocence, assume that they are trying their best and they're not trying to be mean to you. They're not trying to make things more difficult for you. And then talk to them about it. Hey, I didn't like this thing. I was wondering if instead we could do it this way. And then hopefully that will make a big difference and you will be able to move on happily. And if not, then that's when you go up the chain of command and talk to whoever is next for you. Okay, difference between VTAC and pulseless VFib. There is no VFib with a pulse, that it doesn't exist. So there's pulseless VTAC and there is VTAC with a pulse. Ventricular tachycardia, or VTAC, is where the ventricles have taken over initiating that impulse and they are beating too fast. You will see a regular QRS, like it's happening at regular intervals. However, it will be wide. So you will have this sort of like, I don't know, it kind of looks like, I don't even know how to describe it, but that's what VTAC is. It can have a pulse, it can not have a pulse. You can have a pulse and be stable, or you can have a pulse and be unstable. So it's all about assessing your patient, seeing what it is. VFib never has a pulse, is always lethal. Both VTAC and VFib, pulseless VTAC and VFib, can be defibrillated, and should be, while also you should be starting CPR. Okay. What other stuff do you guys want to talk about new grad year? One of the things that I like to tell you about is the idea of exploring what resources exist for you within your specialty. So for instance, I'm a certified emergency nurse. I'm also a trauma certified registered nurse. So I am board certified in emergency and trauma. And why did I do that? Did my job make me do it? Nope, absolutely not. My job for sure did not make me do it. But you know what? I said, this is going to make me a better nurse. And I was 100% right. Studying for these exams, studying to become board certified in my specialty, helped me to learn more about the cases, the conditions, the mechanisms of injury, all of that sort of stuff that I'm going to see on a day-to-day basis. And that's going to be the case for you too. Not all board certifications are ones that you can take right away. For instance, CCRN, a critical care registered nurse, is not a certification that you can just schedule and sit for whenever. You have to have a certain amount of experience, a certain amount of time in a given type of unit, etc. But there is no reason for you to delay studying for that exam. So even if you never plan to sit for it, get those materials, look through those study guides, those reference materials, those books, because that's really telling you, here's the crux of what you're going to see as this type of a nurse. So if you're going to be an ER nurse, check out the CEN study stuff. If you're going to be a trauma nurse, check out TCRN. If you are ICU, CCRN. There's med-surg certifications. There's NICU certifications. There's like external fetal monitoring certifications. There's all different types. And studying for it is always an option, whether or not you're going to sit and take it right now or 2 years from now or never. But I genuinely believe that studying for these two exams made me such a better nurse because I was being exposed to things that I might not see frequently. But also, I was being exposed to considerations about things that I see all the time. And this helped me to kind of have that study in my own time, that self-directed, self-guided study, which was super awesome for my ability to understand what experts in this field believe is the most important stuff to know. So this is a really great way for you to transition into clinical practice from that nursing school mentality where like kind of everything is fair game to like laser focus. Here's the stuff that you need to know in this specialty today. So very, very good idea to get that. Another thing is there's usually like, if you look out there in the world, there are usually like pocket guides for the ER nurse, pocket guide for the NICU nurse. And sometimes it's not even really a pocket guide, it's like a whole book. But this is super duper helpful to helping you, again, understand what it is to be that kind of a nurse. And you are 100% right. What they teach in nursing school is nothing like nursing in real life. If you caught the beginning of this live, I talked exactly about this because this is 100% the case. Nursing school prepares you to be able to think critically and safely in order to pass the NCLEX. The NCLEX is the exam that says that you meet the bare minimum standards to practice competently as a nurse. It does not mean that you now are an expert in emergency nursing or NICU nursing. It means that you have the bare minimum qualifications. The learning you do is on the floor, in the unit, in your facility, whatever kind of a nurse you're going to be. And keep in mind, you do not have to start in a hospital. Let's talk about that really quick because this is another one of my soapbox issues. If you are interested in being a new grad in a specialty, I strongly, strongly encourage you to go for that. There is no requirement for you to start in med-surg. Med-surg is a great place to start if that's what you want to do. However, let me tell you my argument for why you should start in the field of your choosing. I started as a new grad in the emergency room. I knew I wanted to be an ER nurse at a trauma center, and so that is where I started as a new grad. And people love to say, well, you should have started in med-surg. Why? Why? Why should I start in med-surg? Would it not be better for me to be trained from day one how to be an ER nurse? Would it not be better for every second of my new grad experience to be learning how to be this specific type of nurse so that I am really, really good at thinking like an ER nurse? If I start in med-surg, I'll be a really, really good med-surg nurse who's used to thinking like a med-surg nurse. But we have very different roles, responsibilities, and priorities in the ER versus med-surg. Yes, starting in med-surg will give you a really strong foundational basis of assessment, of therapeutic communication, of skills, of time management. However, time management in med-surg looks very different from time management in NICU or ER or ICU because it's different environments. So, what I have seen is that when I have new grads who are in the ER, they are highly moldable and adaptable into becoming extraordinary ER nurses. And I am sure that that holds true across all specialties, including med-surg, which is a specialty. However, when I see nurses who come from other units, I see more of a hurdle, not that they can't become a good ER nurse, but they have to unlearn how to be a med-surg nurse, an ICU nurse, whatever it might be, and then relearn how to be a nurse in an ER setting. So there is no reason for you to start in med-surg unless that is something that you want to do. So if there's a professor out there, a clinical instructor, whoever it may be, telling you that you must start in med-surg, tell them kindly that you don't. Tell them that your Aunt Meris said it's okay. that you don't have to start in med surg. You don't have to tell them at all. You need to know that you don't have to start in med surg. Wherever you want, look into what kind of options there are for you as a new grad. For instance, I did a residency program. I did a complete 1-year residency program where, yes, I had 16 weeks of orientation where I was working with a preceptor, and then I was working independently as an ER nurse. But during that entire 12-month period, I was a nurse resident. And so I went to these seminars. I got to know my other nurse residents. We learned things about like prevention of healthcare associated infections and prevention of different conditions. We talked about burnout and moral injury. We talked about self-care. We talked about patient safety, all these different things that matter. And it gave you a little bit more time to feel supported in your transition to care. There's also things like if you want to be a perioperative nurse, you want to work pre-op, PACU, intraoperatively, whatever it may be, there's like whole residencies and fellowships just for new grads to learn how to become OR nurses or perioperative nurses. There are entire fellowships in my area. You can be part of a critical care fellowship where it's specifically for ICU and ER. There's med surg fellowships. There's all different types of ways to be supported as a new grad, but the situation is that it just depends on where you live, what the hospital facilities in your area might look like, and what their offerings are. So don't panic if you don't see that. It doesn't mean that you can't still start out there and be successful. I just like to look for people who are looking out for new grads. Hey, we see that new grads in the ER typically struggle, so we created XYZ program. Awesome. You're looking out for me. You're thinking about, the things that I need to be successful. Pay attention to what your job offer actually says. Pay attention to things like whether or not there's a contract. Some places have a contract that if you want to start out here, that's great, but you have to agree to stay for 2 years. I'm not saying don't do that. I'm just saying you need to know what is being expected of you so that you don't end up in a situation where you feel like, oh, I'm stuck here now and I didn't realize it. So pay attention to those job offers. See exactly what the information is, the fine print, so that you can be aware. Same thing goes for if there are any sign-on bonuses, and this is the case, I don't care how long you've been a nurse. If there are any sign-on bonuses, you need to read the fine print and see exactly what it says. Is it paid out all at once? Is it paid out over the course of several years? What are the ramifications if I leave before a certain amount of time? All of that stuff matters, so just pay attention to that when you are looking for job offers. When you are interviewing for new grad positions or for any position at any time as a nurse, you've got to be prepared to ask them questions. When they say, "What questions do you have for us?" And you do not need to be asking them about pay, about benefits, about time off. All of that stuff will be discussed with you by HR when you get your offer letter. What you want to ask them are the things that will help you to determine red flags versus green flags of the unit, the facility, the specialty, whatever it may be. I like to ask a couple of questions. I like to ask, can you tell me about the culture of your unit? That is very telling because first of all, they're not going to tell you that it's, oh, well, we kind of bully each other and it's really mean. But what you will see is you will see the people who right away say, the culture of our unit is incredible. We are supportive in XYZ ways. We make sure that new grads are supported in the following ways. We have a unit-based council. We have an open door policy for this. We have, whatever it may be. They're either going to be able to tell you immediately, this is why the culture of our unit is so great, or they're going to stall and go, well, yeah, that's a good question. So red flag. Or they're going to give you some sort of just like vague buzzwords. We're all a family. We look out for each other. Okay. I need you to be a little bit more specific. So I like to ask, what's the culture of the unit? Another question I like to ask is, describe to me your ideal candidate. When you think of somebody who is the most ideal, the most optimal candidate for this position, what qualities do they have? What do you see as someone who is the perfect fit for this unit? Again, two things. It tells you that they can give you that information, and if they're saying stuff like they would be really willing to pick up overtime, Oh my God, no, big red flag. They're willing to take on multiple roles and responsibilities. Oh no, big red flag. I need to take on the roles and responsibilities for just the job that you are hiring me to do. But if they say, oh, this person would be a self-starter, they would be a leader on the unit, they would want to be involved in our unit-based initiatives like unit-based council or other committees, all of that stuff, green flags. They're telling you what kind of a person will be successful there, and it doesn't have anything to do with killing themselves to be great, picking up hours and picking up extra roles and responsibilities. We don't do extra roles and responsibilities unless we are getting extra dollars in our bank account for that. Don't work for free. Don't do it. Yes, the old "we are a family" spiel. I have worked in places where genuinely we all have each other's back. We all get along really well. We have fun together. We work well together. But even still, they are not your family. They are your employer. These are your colleagues. And "we are a family" to me is coded for "we will not treat you well." um, yeah. So be very careful when you hear stuff like that. And it may be just that you're talking to somebody who like just genuinely feels really passionate about their coworkers and stuff, which is awesome. I love the people that I work with. They are the reason I keep showing up every day. I have fun with them. I respect them. They make me feel respected. I really enjoy the people that I work with on the unit, but we're not a family. We're colleagues. So look out for that. Other questions, just like I said before, ask them about their orientation. Tell me how long is your orientation for new grads on this unit? Another good question is if you had someone who felt that they were not ready to come out of orientation, is a longer orientation an available option for them? Is that something that you're willing to do? Or how do you remediate with people new to your unit? If you feel concerned that there's a safety issue or that they don't know a skill, what's your remediation look like for them? Again, do they have an immediate answer? Yep. Oh, absolutely. We do skills day, once a year to check and see how what kind of information you're retaining. We ask your preceptor to give us feedback. We ask for peer feedback so that we can help you improve. Great. We love that. But if they're like, well, it just kind of depends. Okay. Depends on what? Like, because to me that says you haven't given this any thought, so therefore this is not something that you are concerned about. And you should be concerned about that. Other questions, it really depends on your specialty. I love to ask questions about like specific unit things. Do your nurses are your nurses responsible for managing the ventilators, or do you have dedicated respiratory therapists? This is like an ER question. Do you have pharmacists on site 24 hours a day? Mandatory for me. I don't want to go anywhere that there isn't an on-site pharmacist in the ER. Tell me about if you're. I saw a creator on TikTok say they're an ICU nurse and said that one of the questions was, where is your CT scanner located in relation to your unit? Because if you work in an ICU, you're going to be taking people to have CT scans all of the time. And if it is all the way across the hospital and you have like unstable vented patients, that's something you want to know. So there's things that like matter specifically to your unit or your specialty, but you'll get the hang of that as you get farther in your career. The other thing is ask if there's an opportunity to come shadow. I had an interview. I had my phone interview with HR first. It's like a screening interview to make sure that you're, a competent human being. And then they put me through to the unit manager and I talked to her and she said, "Yeah, I would love for you to come and do a peer interview where you get to shadow in the unit. We get to show you the unit and the environment, make sure that this is a good fit for you and for us." Huge green flag to me, right? That says I'm not just trying to get a body with a license in here. I'm trying to get someone who likes this unit and that the unit likes them. So when I went to shadow, I I got to talk to the nurses who were there and say, "How long have you been here?" That's a really great question. Ask a bunch of people how long they've been there. Is this a revolving door? Do people stay here for a long time? What do you like about this unit? What are some ways that you think this unit can improve? All of those are spectacular questions. It's not an attack, right? Tell me the ways that your unit is garbage. No, no. What do you think are the good things about this place, and what do you think are some ways that this place can improve? Gives you really good feedback about their satisfaction. Do they rattle off like a whole list of things they like and only a couple ways that they can improve? Awesome. Or is it flip-flopped? Do they tell you like, well, the people are really nice, but man, our scheduling sucks, our pay sucks, I never get a lunch break. Okay, that's a big red flag. So getting that opportunity to shadow, it also is going to give you valuable information about physically the unit. Is this place nice and clean and new? Is this place run down and there's water dripping out of the ceiling in the stock room? Like, what's going on? Because that is genuinely something that could happen. You could show up for your first day of work and be like, oh no, oh no. So ask about shadowing. If they don't have shadowing as an opportunity, depending on the context, might be a little bit of a red flag for me. Why don't you want me to come see the unit before I accept your job offer? Now, if there's a legitimate reason, like when COVID was really bad, for instance, hey, we would love to do a shadowing interview. It's just not feasible right now because of the liability related to our high COVID acuity. That, yeah, that tracks. But if they're like, yeah, no, we're not doing that. I don't know. That, see what you think about that. The other thing would be just if do you know anybody who works for that hospital, who works on that unit, who works for that facility, anybody who can kind of pick their brains and see what they think, that's going to give you really important information. Even if they don't work on that specific unit, they can give you some information about what it's like to work for that hospital system or that facility. They can tell you their experiences with, vacation, PTO, sick time, benefits, all of that sort of stuff. I find that information to be invaluable. You can also check out Glassdoor. Glassdoor will give you information on like employee satisfaction, pay rates, things of that nature, so that you can understand what is going on in that facility. Definitely check it out and see before committing to anything. That's the other thing is that if they I love this. Does my unit have its own bladder scanner or that's a huge deal breaker. I love that. Yeah, but that sounds silly, but like that's actually a legit question. How many bladder scanners do you have? Do they live on our unit? Basically like how what kind of resources am I going to have available? Another thing I like to ask is about what are your ongoing education initiatives? At my hospital, there's in my facility, in my unit, there's a requirement that ER trauma nurses do a certain amount of ongoing education. And so for me, that looks like I have to do 3 trauma simulations per year. I have to do our skills day every year. I have, of course, the like online education modules that I have to do, but I also have to do some sort of trauma education every 2 years. So when you start, you do like the introductory to trauma course, and then after about a year or two, you would do the trauma nursing core course, TNCC, and then 2 years after that, you could do TCRN, or there's like some different options, but there's things where they're saying we want you to constantly be improving, learning more, etc. So tell me about your ongoing education initiatives. Love that question. Because if they don't have any, to me, that says we're not prioritizing career growth within our field, etc. So those are all questions that I like. You don't have to ask them all, but just kind of whatever makes sense to you, jot them down, be prepared with that. I will tell you that can you tell me about the culture of your unit has been the most popular question from the interviewers when I ask it. Almost every time they say, "Oh, that's a that's a great question." They don't get asked that a lot, but when they say that's a great question, that makes me feel like, okay, green flag. It's awesome that you care about what the culture of our unit is, because you want to make sure that you fit in here or whatever the situation may be. So that I would say is one that has been very successful for me over time. So yeah, what other stuff do you want to know? I feel like I'm just rambling off whatever comes to mind, but I know you guys have to have questions. And if you want to ask me a question, Super Chat is on, but also you can join membership for less than the cost of Super Chat, and then you can chat away. Yeah, tell me what kind of specialties you guys are interested in going into. I'm very biased in that I think that ER is the best. I love ER and I cannot imagine doing any other kind of nursing. But also, if we were all ER nurses, then we wouldn't have anybody to do continuity of care. So thank you, everybody else who is not in ER. I love you very much. One of the things that I would love is if every hospital had some sort of an initiative where you got to cross train, and not even necessarily cross train, but like you got to shadow on the other units. Like I would love for ICU, like new grads to ICU to have to come spend a shift in ER, and new grads to ER have to go spend a shift in ICU and med surge, like all of these sorts of things, because there's a lot of this like competition and this like, oh, the ER never blah blah blah, or like, why does med-surg always ask me when their last bowel movement was, or whatever the thing may be. There's a lot of like cattiness and infighting and stuff like that. But what you got to know is that we are all fighting completely different battles in our units. In the ER, I don't have time to worry about somebody's skin. I don't have time to worry about somebody's last bowel movement unless those things are their primary concern. I'm here to do a focused assessment and then get you to the floor where those things can be addressed. Um, Same thing. I don't know what it's like to be a med-surg nurse or an ICU nurse. I've never done that. So if your hospital has some kind of initiative like that, oh man, take advantage of it. See what other nurses in your facility go through, and that can help you to be a better like interdisciplinary team member. Remember, we're all on the same team, and that's team patient, and there's no need for that infighting and competition. L&D, and I blame your maternity series. Yes, I love this answer. I wanted to be an L&D nurse, or at least I thought I wanted to be an L&D nurse basically my whole adult life. When I was in nursing school, I was 100% confident that I was going to go immediately into labor and delivery, and also that I was going to become a doctor of nursing practice as a certified nurse midwife. I was so confident, in fact, that I applied to the BSN to DNP program in my senior year of nursing school. And then I said, oh no, I don't think this is what I want to do. I think I want to be an ER nurse. And then I got into that program. I got my acceptance and I was stuck with having to decide, do I take the leap of faith that really ER is what I want to do, or do I go with the thing that I thought that I wanted to do for a long time? I don't think that there's a right answer, but I ended up taking the leap of faith that ER is where I was meant to be, and I was definitely correct. I think L&D would have been awesome, and I think labor and delivery and ER nurses are very, very similar in terms of their personality, in terms of the type of nursing that they do. It's just different context. We all triage, ER and L&D, we're triaging patients. We are prioritizing based on acuity, and we also are dealing with the unexpected and emergencies. So I think L&D and ER has very similar kind of personality overlap. So if you go into L&D and you want to branch out, come to the ER, baby. We'd be happy to have you. But we need amazing L&D nurses too. So that is awesome. And I'm really glad that I could help you get there. I hope you love it. I have no doubt that you will, but yeah, I mean, I am a little bit biased. I think ER is pretty great because we get to see everything from OB all the way to like traumas and burns and heart attacks and all kinds of cool stuff. So if you are in Columbus, Ohio, and you want to shadow, please feel free to hit me up at any time and we will make it happen. I love getting to show people why ER is so, so great. It's my favorite. Oh man. Gosh, these replies are making me crack up. The bladder scanner thing, 100%. That's such a good question. What other questions do you have? We have a couple more minutes that I can hang out. Level Up, we have contact hours now. So we are now an ANCC accredited continuing education provider. So we have contact hours that you need to renew your license, your nursing license. You have to have a certain number of continuing education contact hours, depending on what type of licensure and what state. And so we're making contact hours that we think are helpful and interesting based on our experiences. So if you are ever looking for that, please check it out. I also, I'm really into talking about the interventions that we do, and specifically the testing that we do. I know that the hospital, in any capacity, whatever type of a nurse you are, we do a lot of testing, lab tests, imaging, etc. In the ER, that we do a ton of it because basically every patient needs some kind of a workup. And I think it is incredibly helpful to understand the why or the what behind what we're doing. So things like lab studies, what are they? Who gets this? When do I order a troponin versus when am I concerned about getting a lactate? All of those things, you can rote memorize. You can rote memorize that, like, oh, a chest pain patient is going to get a 12 lead, a troponin, CBC, BMP, maybe a D dimer, depending, like you can memorize these things, but it's more helpful to understand why you are doing these things. So another thing I super recommend, and I wish I had done sooner in my new grad career, was that keeping a notebook from day one. Write down things that you learned, even if it seems silly. I didn't start doing this for a little while, and I wish I had done it on day one. Write down the things that you learned that day. All chest pain patients need a 12 lead EKG within 10 minutes of arrival, or whatever your policy is. One of the ones that the first thing I ever wrote down in my notebook was IV amiodarone drips require an inline filter. And now I'll never forget it because I wrote it down. And then second of all, if you ever need to refer back to stuff, you have this kind of guidebook, this manual that you created for yourself. Another thing I would strongly encourage you to do is, in some capacity, I have it as a note in my phone. I've told other people, and they do this with a notebook. A friend of mine took this idea and started sending herself emails. I love it. But whatever you do, come up with some kind of a way to recognize and record your wins. So I have a note in my phone called good nursing moments. And all it is when a patient told me, that I made a difference in their care, or when I made a really good catch, a life-saving catch, or when the doctor complimented me on, advocating for blah, blah, blah. I just wrote down 2 to 3 sentences in my note. My patient today told me that I really helped them when they were feeling scared and overwhelmed, period. Dr. XYZ said that I made a really good catch when I added XYZ test on, whatever the situation may be. And then when things feel bleak, when I feel like I don't know anything, when I have that imposter syndrome, when I'm dealing with a bad day or burnout and moral injury, whatever it may be, I have this list in my phone of things I can go back and look at and say, I'm a good nurse. Maybe today was a bad day, but man, look at all these ways that I'm doing good. It is so important to celebrate your wins, and we focus so much more on the bad stuff than the good stuff that if we don't literally write it down, we won't remember. So yeah, there's a few really great nursing memories that stick out in my head, but there's so many more that I'm going to forget if I don't write it down. So write it down so that when you are feeling low, you've got that to look back on. It's a really nice thing to do. But yes, start that notebook day one, bring it with you. I have another friend who she would write down every medication that she gave. Like within reason, but whatever it might be, amiodarone, norepinephrine drip, mag sulfate, blah, blah, blah. She's writing it down. And then at the end of her shift, she would go and she would look up all of those medications. And then once she had it on the list, she would just put a little tick mark every time she gave it. And now she's seeing also, what are the meds that I give the most frequently, which then helps her to laser focus her review of those medications so that she could become like an expert in administering them. And I think that's such a good idea, especially if pharmacology is something that you historically struggle with. So yeah, just a couple of ideas for you. But yeah, tell me what other questions you have or what else you want to talk about. We've got a few more minutes before I have to hop off. And I feel like I've just been talking at you for so long. And I would love to hear what you want to talk about. I'm going out of town tomorrow, and all I can think about is the mountain of things that I have to do and pack and prepare. But we're going to go see my mom in Virginia for Halloween because Halloween is her favorite thing. And I'm really excited to get to spend that holiday with her and have her show my kids, why she loves Halloween so much. So I'm a little bit overwhelmed thinking about all that I have to do, but I'm also very excited. Um, well, guys, if that's it, that's about all that I had prepared to talk about. We do, if you want to become a YouTube member, we do lives like this all the time. We do a happy hour live once a month, and we do office hours with me once a month, and then we do live product launches as well. And our members always get like extra special discounts and perks and deals. We do giveaways. So definitely, if you haven't already, subscribe to the channel. If you're interested in joining membership so you can get in on our members only perks, that would be awesome. I would love to see you there. We love getting to know our members. I get to see people's names and get to know them and where they are in the program and what kind of a nurse they want to be. And I love getting to form those relationships with you guys. So please know how much I love and appreciate everybody who is a member. It makes me really happy to get to know you in this capacity. I hope you have a fantastic rest of your week. I hope you do something fun for yourself. Studying is super important, but so is rest and recovery. So remember that rest is a productive activity, that it is important to give yourself the space to decompress from all of the really hard things that you're doing and learning. You're doing a super good job, and I'm really proud of you. This is so hard, but you're doing it. So way to go. There you go. You're so welcome. I hope you guys have a fantastic rest of your week, and I will see you in the next one. We're going to have a happy hour. I can't remember exactly. It's like November 12th or 13th. Don't worry, it'll be publicly announced. We're going to play another game of Nurse Squad, so be sure to be on the lookout for the poll where you can vote on which Nurse Squad game we should play. And I'll see you there, and then we'll plan for the next office hours too. All right, guys, have a good rest of your night and happy studying. Bye, friends.